This is part 5 of the Chapter 1 notes. We're not going to go into too many details on the medical imaging. I just want you to kind of know generally what the purposes of a few of them are, and that's about it. So what they are for is to visualize inside the body structures that you normally wouldn't be able to see just from looking at somebody, so surface anatomy, growth structures, and diagnosing problems, disorders, possibly with the anatomy or the physiology. X-rays have been around since the 1940s, so that's your baseline. There's an X-ray of the thorax anterior view. It's quick, inexpensive. Hollow structures appear gray or black. Black is the most hollow structure, so lungs appear black. It's very hollow. Dense structures like bone, the X-ray doesn't pass easily through, so it projects back white. We use this for bones, obviously, and also for soft tissue in a mammogram. Breast tissue is used in bone densometry. I can't say the word. Look at bone density. Okay. MRI, magnetic resonance imaging, so that kind of tells you what's used to get that picture. It's an extremely powerful magnetic field. So if you have any metal on you, they ask you to take it off before an MRI. I've had an MRI of my head done, and I have a little metal, or I did have a little metal thing from braces in there, so they had to know that. So it can mess up the image, so you got to take that into account. So they shine protons, or no, your protons in your body align with that magnetic field that they are shining at you, and kind of gives you a colorful picture that can show brain abnormalities. For me, that's what they were looking for. But I'm okay, don't worry. Or tumors, looking at blood flow, more of the soft tissue. They also produce 2D or 3D images that can be viewed on the monitor. A CT scan, it's X-rays organized in a 3D image. It's soft tissue to visualize it in more detail than just an X-ray. So here you can hear transverse section of the thorax. Here's the heart and the lungs. Tissue intensity show varying degrees of gray. So the softest tissue is going to be black. There's going to be some different arrangements of gray depending on how dense the tissues are. Whole body CT scans, you have to be put under high doses of X-rays. And any kind of X-ray imaging you don't want to do if you're compromised, like pregnant women. They don't want to do that too. It could induce mutations into the growing child inside. So here's a cool picture. I think this is you can see where they cut a cadaver skull. This is just a picture of inside where the brain would sit, and you can see the orbital sockets in the nasal area here. Here is a CT scan at that same level plane. You can see it shows a lot of the bone structures, the internal bones. You got some cool bones in your skull. This is the sphenoid bone that looks like a butterfly. And this is an MRI scan. There's different purposes for the different scans depending on what doctors need to see. A sonogram, ultrasound, also called that, is they shine, or not shine, put sound waves, project sound waves. And it's non-invasive and painless. So it's used relatively frequently because it doesn't really hurt and cause any harm. It's used for fetal development as a woman is progressing in her pregnancy to check that the child is progressing as it should and check for any abnormalities. These two I'm not going to talk too much about, but they give the person a radioactive substance intravenously, so into their veins, and then your tissues will emit gamma rays that take up that radionucleotide, and you can see it on the monitor. This is brain, and you can indicate how much uptake or how much activity that part of the brain. A PET scan, they inject positively charged particles into the body, and then These positrons interact with your electrons to produce gamma rays as well, and it produces a computer image. So again, you can see the soft tissue of the brain. Doesn't have activity like it should. This is where a stroke was in a victim. Over here, it should be red like that on the right side. But you can see it's missing that. That's the damage that the stroke caused to that person. So it's used to study the physiology, so how the brain is working, rather than just anatomy. Endoscopy looks at the interior of different parts of the body using a lighted instrument with a lens, and you project it onto a monitor. Colonoscopy, go into the colon to look for polyps, for example, or little extensions. Laparoscopy, anything in the abdominopelvic cavity, and arthroscopy, it is the interior of a joint. Any technique that is non-invasive is called a non-invasive technique, and they're going to search for the presence of disease, assess the structure, is it normal, and the function of that structure, is it a normal function, is it carrying it out. So like I said before, palpitation is touching with your hands. If somebody breaks their clavicle, you could palpitate it if they let you and feel that it is broken. Auscultation is listening to sounds. Usually they use a stethoscope, so they'll listen to the sounds of your lungs, heart. Percussion, tapping, to listen to echoes. And that is the end of Chapter 1.